This series of videos on being autistic was originally written for therapists, but I see no reason why most of it shouldn't be equally useful for anyone who is interacting with autistic people, which means pretty much everyone. There are a lot of us about. I've divided it into 4 sections: on language and labels, on double empathy and Chinese whispers, navigating the world as an autist, and therapy, communication and environment. Starting with on language and labels. How do we talk about autism and autistic people? How do we describe them? And how do we autists describe us? Useful and less useful ideas and expressions. Can I just reassure you that most of us are pretty reasonable, and while we might tut a bit if someone uses, for example, a functioning label, we don't assume ill will or malice, and will explain the problem if you ask. Language can be a bit of a minefield. I think we've all had the experience of being told that we're being offensive when there was nothing further from our mind. So before even starting on the first session, on language, I would like to give you a corrective from Naoki Higashida, who wrote his first book on being autistic at the age of 13. I quote him rather a lot. This is from his second book, Fall Down 7 Times, Get Up 8, and was his response when asked whether he would like a new word for autism in Japanese, rather than jiheisho, self-locked up disease. Apologies for my Japanese pronunciation. It is telling. Language is important, and at the same time, other things are important too. So Naoki says, I can understand why some people would like jisheiso, self-locked up disease, to be changed. But personally speaking, I can live with the word. Changing the name of a disability would take a vast amount of energy, and I'd prefer it if these resources were applied to making our society a more autism-friendly place. The purpose of these videos is not to inform you about the history of autism, or even the history of theories about autism, from Leo Kanner via Asperger, Temple Grandin and Baron Cohen to Steve Silberman and Damien Milton, although I will be mentioning most of these people. You can find that in books or even in Wikipedia, and you probably don't even need to know most of it to be able to support autistic clients. Because my purpose in this workshop isn't to inform you about autism in a vacuum. It is to support you to work with actually autistic clients in the present day, to make your own world a more autism-friendly place. I'm not even an expert in autism, except in that I'm autistic myself, know a lot of autistic people, both personally and professionally, and because this is what we do, and because for me my self-diagnosis was such a joyful revelation, autism has become a special interest. More on special interests later. I will also not be talking much about the diagnostic process or criteria. We will leave that to the psychologists and psychiatrists whose job it is. As society stands at the moment, we do need diagnoses because our difference is one that society does not accept. Just as it didn't accept being gay barely a generation ago. We have the choice, as things stand, between camouflaging, masking, trying to pass, and failing. Being regarded as weird, willfully difficult, or mentally ill, or getting a label, which at least tells people that we are officially different. How they then view that difference will vary, but at least they have been given an explanation. The medical model, the deficiency model of autism, is one that we have to live with for the moment. I think it is as well for you to know what the diagnostic criteria are. I've given DSM-5 rather than ICD-11, because in practice that seems to be the one that's used. Most of these points will be discussed at least in passing in these videos, but I'll do a rapid canter through them now. Please If you're trying to understand what an autistic person might look like, or what it might be like to be autistic, don't just take these basic criteria and think they say everything. They say almost nothing, and are seen, never forget this, from a neurotypical point of view from outside. Interestingly, the three basic ones, the ones that a person must fulfill in order to be diagnosed as autistic, are all thrown into question as deficiencies by the double empathy theory. We absolutely accept that we do have these difficulties in a non-autistic context, but most of us would question whether they should be regarded as deficits or simply differences. I hope that by the end of the fourth video you will understand why. As to the second group, the first criterion is referring largely to stimming. These are the physical things that we do, visible or audible, to self-soothe or self-regulate. They provide predictable sensory input and can successfully tune out the chaos outside or inside. They include things like playing with fidget toys, repeating a line of a poem or a song over and over, foot tapping. My point is that they serve a purpose. Most of us can stop stimming, but the effect is to increase stress and overwhelm. The world is chaotic, neurotypical society is baffling, and sometimes our minds are chaotic and baffling too. Controllable sensory input is invaluable. The second, it is perfectly true that most of us find routines a relief. Not routines imposed from outside, routines from within ourselves. One of my clients, and if I quote a client, it is always with express permission, said that it's not routine so much as rhythm. I thought that was spot on, and it goes well with our habit of stimming, which is so often rhythmic. Doing things in the same way takes away some of the stress, some of the need to make decisions. I might even say it takes away some of the threat of that baffling world out there, where our senses are constantly assaulted. Because part of this preference for sameness is linked to our sensory sensitivities. Textures, sounds, smells assault us all the time. If we can reduce this to a manageable level, then living on macaroni cheese is a small price to pay. I'd say that the thing about highly restricted interests shows almost as much of a misunderstanding as the whole lack of social skills and empathy thing does. Our interests are not so much restricted as focused and passionate. Dinah Murray suggests that rather than being a deficit, this is simply a characteristic of the autistic mind, which she calls monotropism. More on that later. And by the way, the train schedules thing, stereotype or what? I don't know a single autistic person, and I know many, who is into train schedules. What are we into? Well, circus skills, embroidery, traditional music. I can bore for Scotland on the blind Irish harpist Turlough O'Carolan. Psychology, photography, dogs, cats, horses, bridges, autism. The fourth point is a very important one. I, as a non-scientist, would go so far as to say that the different sensory sensitivity and processing, is the one constant in all autistic people, however different we are from each other. If I am wondering whether somebody is autistic, that is always the area I will go to first. It is only within the last 5 years that the scientific community has realized just how important our sensory processing is and how it impacts on the way we behave and present. So, on language and labels. I'll divide this into 4 sections. Neurodiversity and neurodivergence, person first or identity first, high and low functioning, or mild and severe autism, and co-occurring conditions and the environment. You will notice a thread running through these videos, which is myth-busting, or, if you like, reformulating. And the most basic of these reformulations is the concept of neurodivergence. It is worth looking into the neurodiversity movement, founded by Judy Singer, which sees autism as a valid neurotype, Watch the word neurotype, though, as it could suggest that autistic brains are somehow physically different in appearance or behavior to non-autistic ones. At least the jury is still out on this. At most, it does not appear to be the case. Neurodiversity and neurodivergence are not scientific terms but social ones and political ones. Some of us like to see neurodiversity as parallel to other types of diversity: biodiversity, diverse ethnicities, native languages. This is what Nick Walker, the coiner of the word neurocosmopolitanism, one of my favourite words, said about neurodiversity. Neurodiversity is a natural and valuable form of human diversity. The idea that there is one normal or healthy type of brain or mind, or one right style of neurocognitive functioning, is a culturally constructed fiction, no more valid and no more conducive to a healthy society or to the overall well-being of humanity than the idea that there is one normal or right ethnicity, gender, or culture. The social dynamics that manifest in regard to neurodiversity are similar to the social dynamics that manifest in regard to other forms of human diversity. For example, diversity of ethnicity, gender, or culture. These dynamics include the dynamics of social power inequalities and also the dynamics by which diversity, when embraced, acts as a source of creative potential. I assume that everyone listening would be shocked at the notion that there is one normal or right ethnicity, gender, or culture. But all those things have been posited, and you don't need to be a paid-up Nazi to buy into the concept of a superior ethnicity or culture. I hope that with time, the notion that there's one right style of neurocognitive functioning will seem just as shocking. There is an example of this one right culture from my own country in the not-so-distant past. It's not so long since children were beaten in school for speaking Scots, never mind Gaelic. Gaelic has reached the point, despite the best efforts of speakers and organisations, at which it looks as if it's going the way of Manx or Cornish, languages that are kept artificially alive, but which have no first language speakers, and certainly no monoglot speakers. Gaelic is not dying a natural death. If it is dying, it was murder. If you draw the parallel with autism, the view was that Gaelic speaking was an inferior way of being, a disorder, something to be cured or eradicated. I don't think this is a wild parallel. Seeing autism as a culture with its own native language and its own set of idioms is a useful approach. It goes hand in hand with the double empathy problem to explain why autistic and non-autistic people have so much difficulty in understanding each other. For example, it's often said, with some truth, that autistic people struggle with idioms. We sometimes do, because they are not idioms in our language. In Gaelic, we have an idiom which says, "Listen to the mountain wind until the waters subside. Eistri an biaun gus an thrun a hushkachan." Do you know what that means? You might be able to guess, but you're just as likely to guess wrong as right, because it is not your culture, even translated into English. It means keep a low profile until the danger is past, or even if there's a stushy kicking off, don't interfere. What? Well, that's what it feels like to be autistic in a neurotypical conversation. Neurodiversity is a natural and valuable form of human diversity. You can also see it as parallel with biodiversity. The world is biodiverse, culturally diverse, ethnically diverse, and neurodiverse. By the way, a linguistic point. Sorry, I'm a pedant. It makes no sense to call a person neurodiverse, any more than it would to make sense to call a rare butterfly biodiverse. If there is something about that butterfly that marks it out as different from your average butterfly, then you might possibly call it biodivergent. That wouldn't be a value judgment, simply an observed fact. And it is part of biodiversity, just as the biotypical, if I may coin such a word, cabbage white is. We are all neurodiverse. All of you watching this video. The people in a lecture hall, a concert hall, a theatre, the people walking down Princess Street in Edinburgh. But some of us are neurotypical, the majority, and some of us are in some way neurodivergent, a minority. So I am not neurodiverse. We are neurodiverse, but I am neurodivergent. People can choose to be racist, or they can choose to be cosmopolitan. People can choose to be neuro-racists, or they can choose to be neuro-cosmopolitan. That doesn't mean you will miraculously understand the language and culture of people who live in Sweden or Nicaragua, but it does mean that you will treat that language and culture as equally valid to yours. If you are neuro-cosmopolitan, you will not necessarily understand the language and culture, the processing system, of people of different neuro-tribes. Thank you, Steve Silberman. But you will treat them as equally valid to yours. If you pause for a moment and let the implications of the concept of neurodiversity sink in, then you will realize just how revolutionary it is. If autism is simply a valid neurotype, I won't give you the caveat each time I use that word, but bear it in mind. If it is one element in the neurodiversity that makes up the totality of humans, then what are the implications for the way we see autistic people, the way we talk about them, and the way we interact with them and support them? Because, make no mistake, we do need support in this weird society that we find ourselves in, a society that isn't designed for us. As Damian Milton puts it, the concept of neurodiversity suggests that variations in neurological development are part of natural diversity, rather than something to be pathologized using a purely medical model of disability, defined by one's deviation from the statistical or idealized norms of observed behavior. This is not to say that those who identify as autistic people or other forms of neuroidentity do not find life challenging. We do. So let's start at the beginning with the language we use. There are some non-negotiables, and there are some points on which we autists differ. In those cases, if in doubt, ask. And first, person with autism or autistic person. And how about Asperger's syndrome and PDD-NOS, that's pervasive developmental disorder not otherwise specified? Don't you love those definitions? And the other diagnoses that you might come across. While the vast majority of autistic people prefer identity-first language, and will call ourselves autistic, I like autist myself, but not everybody does. Some people do prefer person-first language. They will tell you if they do. However, please, if you are not autistic, use identity-first language, as that is what, as I say, the vast majority of us prefer. It is no more than ordinary respect and courtesy to use the language that we prefer for ourselves. Autists, like most oppressed minorities, are pretty sensitive about the way we are spoken about. Unless you are a psychologist or psychiatrist diagnosing, please do not use ASD, autism spectrum disorder. I have even heard he is ASD, which is literally calling a person a disorder. You might be surprised at the choice of identity-first language. The people, almost all non-autistic, who use person-first, seem to have decided that it is more respectful to say person with autism on the basis that it acknowledges the personhood of the autist and minimizes the autism. The autism doesn't define you, they say. We find this problematic. Firstly, is it so uncertain that we are persons that it has to be clearly stated? And second, why would it be so bad if autism were a defining characteristic? True, it is not the only thing about us, but it is the basic configuration of characteristics that makes us us. As Becca-Laurie Hector puts it, neurology is not an accessory. Autism is also not a disease to be regretted, palliated, or cured. I may currently be a person with a cold or a broken leg, but those things are to be regretted and recovered from, we hope completely. But I am not a person with autism, any more than I am a person with femaleness, whiteness, empathy, and logic. I am a logical, empathic, white woman. None of these things could be removed from me without affecting who I am. And neither can autism. And well, it's a strange way to show respect, it seems to me, to tell a person that the way they choose to refer to themselves is invalid. As a gay woman, I may call myself queer or even a dyke. I don't expect to hear those words applied to me by a straight person who does not know me. I have friends whose diagnosis dates back to the days when autism without intellectual disability was known as Asperger's syndrome. They may call themselves Aspies. Please do not use that word unless you know that the person you're talking to likes it as their label of choice. People who were given the label PDD-NOS may really struggle with it, as if somehow they were not autistic enough, but not neurotypical either. They may feel that they have failed both as an autist and as a neurotypical. Don't use it. I am glad to say that neither Asperger's nor PDD-NOS are used as diagnoses anymore. We are all autistic. You may still come across both. They were both used as diagnoses until 2013. You may have noticed that I said autism without intellectual disability, rather than high-functioning autism. Autists almost without exception reject the functioning labels. Many people discussing autism are probably unaware of just how wide-ranging and multidimensional a spectrum it is. If you think of a rainbow, it is not simply 7 strips of colour placed side by side. There are myriad shades of each colour, and they merge into each other. The autistic spectrum looks more like this slide than like something linear. And that is important once you start discussing the concept of high and low functioning, mild and severe, and any scale like that. And most of the things you will read are written from the point of view of a neurotypical person talking about them. I look at the photographs on the website of a well-known autism charity, and in almost every one it is perfectly obvious which of the people in the photograph is not quite right. That is not an accurate picture of an autistic person. This is an accurate picture of an autistic person. You may even recognize her. We look like everyone else. What makes us appear odd or not odd, high or low functioning, is not our autism per se, but what other conditions we have. People without significant co-occurring conditions are still battling with the noise, the light, the social dance whose steps we do not know, the weird and incomprehensible neurotypical world, the lack of brain filter, the poor executive function, that is certainly true, and the rest. It is extremely difficult to do. We function well, but at what a cost, while we are still trying to do neurotypical and not looking autistic. If I had £1 for every time I've been told that. Co-occurring conditions, especially depression and anxiety, both very common, or intellectual disability, are what push us over the edge into what is seen as low functioning. You want to see a high-functioning autist when we melt down or shut down. I guarantee you would write any of us off as low-functioning. That same person, maybe tomorrow, will be lecturing on astrophysics or classics, directing air traffic, or being your surgeon or psychotherapist. As Chris Bonello says, I am high-functioning until I'm not. And Shona Murphy, an autistic academic and advocate, rightly says of a so-called high-functioning individual, most of the time their anxiety is extremely high, so it does not take much additional stress for them to melt down and stop functioning completely, albeit temporarily. It would not have been so hard for that person to have ended up homeless, unemployed, or in prison. Sometimes the difference between functioning and not is on a knife edge, and circumstances and luck are a big factor. As Luc Bairden neatly puts it, autism plus environment equals outcome. Similarly, I was recently at a training called Autism in the Therapy Room, where it was almost a given that the autism would belong, so to speak, to the client, not the therapist, because, well, the therapist is high functioning. For an autistic psychotherapist who belongs to a group of over 200 autistic therapists and to the Association of Neurodivergent Therapists, that is not only offensive, of course it is offensive, but also deeply weird and outdated. When I was growing up in the 60s and 70s, the picture we had of autism was of a non-verbal, probably violent and unmanageable boy, and the stories were all about the parents' struggle and heartbreak. We know a lot more about autism now, and yet that is still the underlying picture that we carry around. And it is a picture from outside. As someone said, you see behavior and you try to change it. We have experiences and we try to survive them. Then along came Rain Man, Mr. Spock, Sheldon Cooper, and the like. Again, we have a stereotypical picture. The slightly odd single man, geeky, logical, obsessive, and with no social skills. Yet again, it is a picture from outside. The autistic clients you will meet, diagnosed, self-diagnosed, or questioning, will mostly not look like either of these stereotypes. Unless they come to you in crisis, they will look just like you. They will do the small talk when they come into your office. They will do the eye contact. They will smile. They will crack a joke. And they will not, however tempted they are, pick up that maddening ticking clock and hurl it through your window. Well, I hear you, chorus. Of course not. They have self-referred. They are high-functioning. As I mentioned, autists almost without exception reject the functioning labels. There are many reasons for that. Both labels are damaging. As autistic self-advocate Laura Tisonchik puts it, the difference between high-functioning and low-functioning is that high-functioning means your needs are ignored, and low-functioning means that your capacities are ignored. And they don't actually mean much. One wit commented, "What you mean by high-functioning is that we can pass as neurotypical and we don't disturb you too much." The struggle to pass as neurotypical is, by the way, one of the main sources of stress and distress for autistic people. And we'll deal with that in the context of what an autistic client might struggle with and what support they might need. But there is no such thing as mild and severe autism, or high and low functioning autism. Autism is not a disease or as such an impairment. It is an operating system, a style of neurocognitive functioning. We autists are all equally autistic. I am exactly as autistic as Naoki Higashida, the non-verbal, so-called severely autistic author at the age of 13 of the book The Reason I Jump. As I've said, I quote Naoki quite a lot, partly because he expresses and explains the autistic experience so accurately, and partly because he so skillfully destroys all those stereotypes. No theory of mind. Listen to Naoki musing on why his fellow pupils are so shy at the beginning of the school term. No empathy. Listen to Naoki talking about his mother. No creativity. Read his short stories and poems. So, what makes the difference? Why am I a busy and successful self-employed counsellor, here talking to you reasonably fluently about supporting clients, while some autists will never speak and some will never be able to live independently? Two things make the difference: environment and co-occurring conditions. So, second thing first, co-occurring conditions. It only takes a moment's thought to realize that there are plenty of non-autistic people who will never speak and will never be able to live independently. That doesn't mean they have severe low-functioning neurotypicality. I think I'm going to leave a minute to let the penny drop on that one. It doesn't mean they have severe low-functioning neurotypicality. It is vanishingly rare for an autist not to have any co-occurring conditions. If you include sensory issues, it probably never happens. And it's the co-occurring conditions that make us struggle, beyond the struggle that we have in any case, trying to live in a society that isn't designed for us. T. Monette, whom I might be mispronouncing, and who posts as Unmasked24 on the Neuroclastic site, and who is classified as having level 3 support needs. Support needs are a better, if not ideal, way of classifying autism, if you must. Please don't. Says this, and I would echo almost every word. In order to really move forward with how we think and talk about autistic people, we have to address what people know as severe autism. When most people see a child screaming and flailing, looking all around, unresponsive to people's communication, not toilet trained, making grunts and gestures, they can't also see competence at the same time. They see something they must fix. I don't see someone who needs to be fixed. I can look right at a kid displaying all of these behaviors and see myself. And I don't see myself as broken. You know by now, autistic people understand each other. And I too had low expectations based on my level of life skills. Support needs have nothing to do with if you can talk or type articulately. We need to address what high support needs can still look like. You can talk. You can walk. You can type your thoughts clearly and be all there. Severe autism is not a type of autism. Co-occurring conditions which are complicated by autism and vice versa may impact what people see on the outside as severity levels. So that's what you're seeing when you see a person with severe or low-functioning autism. You're seeing, to quote T again, dyspraxia or sensory processing disorder or dyscalculia or photophobia or misophonia or visual processing or auditory processing disorder, and many other conditions besides. There may, for example, be several reasons why an autist can't speak. They may have an intellectual disability, sure, but they may also, for example, have apraxia. There is a high rate of apraxia among non-speaking autistics. Some non-speakers, or minimal speakers, appear to have a developmental motor disorder rather than an intellectual disability or a lack of understanding. If you actually pay attention to what non-speakers have written, and they've written a lot, there is a persistent reference to a mind-body disconnect, an inability to plan motor functioning. There may be apraxia of speech, where the brain has difficulty coordinating the muscle movements for speech. If these non-speakers are offered alternative methods of communication, then they will be able to communicate just as well, though not as quickly, as you or I. I recommend you read the blog posts of Harry Srinivasan and Nico Boscovich, among many others. So much for co-occurring conditions. Now, the environment. And this will be very important for you in supporting your autistic clients or understanding your autistic friends. and as a guide for possible reasonable adjustments. It can be very helpful if you can give some guidance on this, as many workplaces, even those which are genuinely well disposed, struggle to know where to start. Universities tend to be better, but even then they can do with some help sometimes. There are two ways in which the environment can be problematic. The first is simply that it is bewildering for people who think and process differently. I'll tell you a wee story. When I went for my diagnosis, the diagnostician said, "Get us a cup of coffee, would you, while I sort out my things?" I don't know whether it was casual or intended, but she commented at the end of the day, "When I saw you hovering around the coffee machine, no idea which way the queue was going, unsure how close you needed to be to the next person in order to be visibly in the queue, but doing all you could to avoid interaction, and then with no idea how the machine worked. We could have dispensed with the whole diagnostic process." She was joking, of course, but there is a lot of truth in it. The world is bewildering. If getting a cup of coffee from a machine is visibly a problem to a pretty competent professional woman who's been passing, more or less, as neurotypical for more than half a century, what do you think it's like for a child or adolescent, or a young adult who is just starting to live an independent life in a world that is just not designed for them? Expand that coffee machine experience to every single interaction, task, conversation in this neurotypical world, and you will see why we have such a high incidence of mental health issues. And then there are the sensory issues. We all, I think without exception, have difference in sensory perception and processing. We may have hypersensitivity in some areas and hyposensitivity in others. I rather rapidly listed some likely co-occurring conditions earlier. I'll give you an expanded version of that. Dyspraxia, dyslexia, dyscalculia, photophobia, misophonia, sensory processing disorder, visual processing disorder, auditory processing disorder, poor executive function. And that's before you even start on the physical issues like Ehlers-Danlos syndrome, visual stress and digestive issues, or yes, the very high incidence of mental health issues, such as anxiety, depression, OCD, eating disorders, and suicidality. We'll go into those in a later video. This is an attempt to give you an idea of the autistic sensory experience. We struggle with bright lights. They may not seem bright to you. Flickering lights. They may not seem to flicker to you. Loud noises, either sudden or ambient. They may not seem loud to you. Persistent noises, a dripping tap, a ticking clock, the hum of a fridge. Apparently, we don't habituate. After a while, a neurotypical person probably won't hear that ticking clock. Their brains register the sound as unimportant and filter it out. It seems we can't do that. When I used to work as a counsellor in several different places, I always took my own silent clocks with me. If there is a ticking clock in the room, I cannot concentrate. And I don't mean I find it a bit distracting. I mean, I can't concentrate. I can't work. I can't even think. Hotel rooms, conference centres, colleges, they are a source of dread to me because the environment cannot be controlled. And if there is bright, flickering, buzzing fluorescent light, then I might just as well not have gone to the conference or the training. If the boiler or generator hums, or indeed the fridge, if you're in an upmarket B&B, I might just as well have gone for an all-night hike rather than trying to sleep in that B&B or college. I am like a terrier in chasing down little noises and eliminating them. It is hard to express how extreme our sensory experiences can be. There is a certain sound that's part of a radio station's jingle that to me is like a searing migraine-like headache. Yes, BBC Sounds, I'm talking to you. We are not talking about discomfort or dislike. We are talking about pain, sometimes intense pain, and sometimes the complete dismantling of our capacity to think, talk, or register anything else. A bit less extreme but disabling is the common inability to scan a section in a supermarket or a library. There is too much visual information and we cannot interpret it. It may take your autistic clients twice or 10 times as long to find a book in a library. They may be unable to use a supermarket, and they may struggle with a cafe. Too much unfiltered information and often too many unwritten rules. Remember the coffee machine? Here is an extract from David Mitchell's intro to The Reason I Jump by Naoki Higashida. It is extreme, and we don't all experience all of this, but it is a pretty fair description of our autistic world. When one of your autistic clients or friends goes nonverbal, remember this extract. A dam burst of ideas, memories, impulses and thought is cascading over you unstoppably. Your mind is a room where 20 radios, all tuned to different stations, are blaring out voices and music. Apologies, that was my cat waking up. The radios have no off switches or volume controls. The room you're in has no door or window, and relief will come only when you're too exhausted to stay awake. Sensory input from your environment is flooding in too, unfiltered in quality and overwhelming in quantity. Colours and patterns swim and clamour for your attention. The fabric conditioner in your sweater smells as strong as air freshener fired up your nostrils. Your comfy jeans are now as scratchy as steel wool. Your vestibular and proprioceptive sensors are also out of kilter, so the floor keeps tilting like a ferry in heavy seas, and you're no longer sure where your hands and feet are in relation to the rest of you. You can feel the plates of your skull, plus your facial muscles and your jaw. Your head feels trapped inside a motorbike helmet 3 sizes too small, which may or may not explain why the air conditioner is as deafening as an electric drill. But your father, who's right here in front of you, sounds as if he's speaking to you from a cell phone on a train going through lots of short tunnels in fluent Cantonese. I often surprise people by saying that when I read Naoki's work, I recognize a fellow autist and feel a strong identification with him, a person with the same neuroculture as mine. People, and maybe you, might be surprised that I, an autist labelled as high-functioning, feel such an identification with Naoki, an autist labelled as low-functioning. What surprises me far more is that I, an English-Scottish woman of Hungarian extraction, born in 1956 and approaching pension age, feel such identification with a 13-year-old Japanese boy. In so many things we are as one. And you know, some of the things that I recognize are some of the things that give him that low-functioning label. I too shut down when overwhelmed. I too find myself unable to speak sometimes. I too can melt down quite dramatically. I know just what it feels like. Because of my relative lack of co-occurring conditions, my window of tolerance is far larger than his. But when I melt down or shut down, I melt down and shut down just as Naoki does. As T. Monette says in the piece I quoted above, I can look right at a kid displaying all of these behaviours and see myself. You know by now. Autistic people understand each other. I hope, after listening to this video, you understand us a little better. 3 more to come.